Hello guys, it is medical information, and in this session I want to speak about radicular low back pain. The pain that is excruciating and radiating to the legs. Radicular low back pain happens due to the rupture of the intervertebral disc and the nucleus pulposus. This material here herniates through the annulus fibrosus, this part, and the herniated nucleus pulposus will compress the spinal nerves, and the symptoms begin here. And in this MRI you can observe that this intervertebral disc is compressing the spinal cord here in the posterolateral position, and it can cause radicular symptoms. The most affected nerves are S1 and L5 roots, and sometimes L4 roots. Based on the affected nerve, some pathways can be observed for the radiating pain. For example, the blue color here in the posterior position of the thigh and foreleg shows the root for S1 nerve, and the yellow color here in the lateral position of thigh and the lateral position of foreleg shows the root of L5 radiating pain, and the L4 comes through the lateral position of the thigh, and then it goes through the medial position of the foreleg. There are some alarm signs that need emergent attention because the patient will lose the function of those nerves in a matter of days. One of them is saddle anesthesia, which means insensation in this yellow colored area. The other one is foot drop, and also urinary and fecal incontinence need emergent attention, and they must the patients must undergo surgery to decompress the affected nerve and improve its function. If the patient delay the surgery, the nerve will be dead and the function is lost forever. There are also other alarm signs that necessitate imaging, but they are not emergent. For example, a history of recent trauma, fever, exacerbation of backache with resting and nocturnal backache, or using corticosteroids, or being immunocompromised, or if the patient had recently cancer or he is a drug addict. These alarm signs necessitate imaging because imaging is not routinely ordered for a low back pain until it has been 2 months from its initiation, or it doesn't respond to routine therapies. These alarm signs can be in favor of fracture, infection, or metastasis of a recent tumor. What are the management of acute low back pain? First of all, resting is recommended for up to 48 hours, and resting for more than 48 hours is not recommended because it can lead to decreasing of muscle strength, and it can exacerbate the pain and nerve functions. Also, yes, severe physical activity must be avoided, but the physical activity must be gradually initiated. Painkillers, first of all, acetaminophen, and then NSAIDs, for example, naproxen, diclofenac, or indomethacin, are recommended for an acute low back pain. Also, in severe cases, local steroids can decrease the inflammation of the herniated disc, and it can significantly improve the pain. For lying on your bellies, you will increase the lordosis, the concavity of the lumbar vertebrae, and it can exacerbate the pain and the compression in the long term. But if you want to rest, it is better to rest on your flanks and bending your knees. Exercise is recommended after improving from an acute episode to improve your muscle strength, particularly the abdominal muscles. If you enjoyed this video, please don't forget to like, comment and subscribe. See you soon.